Hello, everyone, and welcome back to the Student Nurse Lounge. Today, we have a very special guest, Sarah, from the last episode as well, who is now here to share more about her experiences. Um, and so I will start by introducing myself. I'm Farah. I'm in my first year of the nursing collaborative program at the University of Alberta. Ivy, would you like to go next?
Yeah, sure. My name is Ivy. I'm also in my first year of nursing school at U of A. And Sarah.
Yeah, hi everyone. I'm a recent new grad. I also graduated from the U of A in April of 2023, so a few months out now. I mostly work in women's health and also public health.
So yeah, welcome everyone. Farah, do you want to briefly introduce our podcast? Like, what does it include? What have we been up to? What kind of topics we covered, and what are the goals?
We started this podcast in order to share unique experiences about nursing school and have a platform where we can communicate with our nursing cohort and have them as guests and talk about things that are relevant to our degree. And we just think that our program is kind of unique. Every program is unique in its own way, but our program is unique in that it's not, we don't it's not like the first thing that comes to your mind when you think of university. It's more hands-on simulation labs. For the past few episodes, we've been talking about what we think about inequities in healthcare and the different faculties across the university and giving some tips about how to manage university as a first year and things like that. Um, yeah. Um, I want to ask you a question, Sarah. So, what is your current understanding of professional role transition into the workplace?
Yeah, so from my understanding, professional role transition is a term that is used to describe the transition of a student entering their profession. So, for example, nursing student to a registered nurse, and then what that process looks like, maybe psychologically, and also just skill wise, maybe, and the kinds of tools and like things that might be in place to kind of help assist them with that transition, because it's very different being a student nurse versus being a registered nurse. That's a very hard transition, especially in the first year for a lot of people, because what you learn in school isn't necessarily what's done in practice.
Yeah, that's very interesting. Yeah, I felt like must be like the gap between nursing school and like stepping into the workforce. So like in the first 3 months of your moving into the professional practice, what was it like?
Yeah, so for a lot of new grad nurses who enter the field, they usually have buddy shifts in place, and that's usually that's a part of the collective agreement. So a certain number, I think it's around 7 or 8 buddy shifts. So you're paired with a nurse, and then you would basically see the ins and outs of the unit. But for specific specialties, there's a longer training program. So like for ICU, they actually have around like a 6 month training program. For the NICU, it's around 3 months, probably more. I'm not entirely sure, but I feel like I remember it being 3 months. So that should help like nurses transition too, just because it's hard to get exposure to that in nursing school. So once you're actually working, right, it's really hard to get those skills and know and like really understand that specific specialty if you don't have that training. Also, another thing that really, or another person that could really help with the transition are your CNEs, so your clinical nurse educators. So they actually create orientation programs, and they can help facilitate learning. If you ever have any questions about anything, they can always help you. And just orientation in general, they make you take like education classes about like how to do certain skills that maybe you didn't have the chance to do in school, or things that you just weren't allowed to do as a student, really. So then you get the education, so then you're able to do it like as a part of your job.
I see. And follow up question: what do you think the like your experience in nursing school could have been like? What do you think about your experience in nursing school, which could have been different in order to prepare you for the workplace? Like, how do you think? Do you think any supports would have prepared you to be a new graduate or anything like that?
So for nursing school, I feel like it would have been beneficial to see kind of like what the reporting protocols look like. For example, if there's something's abnormal, usually we're taught that you'd go to your buddy nurse, right? And then that your buddy nurse would kind of deal with it, but you might not see the whole picture and like what that looks like and how that would change a treatment plan for that patient. And like even things such as carrying out new orders or something, you know what I mean? Like skills that you aren't allowed to do in nursing school. It would just be nice to know, like get exposure to that, not even just doing the skill, right? Because you're not supposed to do certain things because it's risky behavior, you know what I mean? Like, or more of a high risk skill. So just having an understanding of like a better understanding of those skills would be nice. And I think a big part of the transition too is just like mentally preparing for it as well, because nursing school is nothing like nursing practice. So just dealing with that, you know, the hierarchy, the different roles in the healthcare team, and like who you can ask for help, like even CNEs, like that's something that we don't get a lot of exposure to in school. And then once you start working, you like really start to utilize your CNEs, and they're a really good resource on the unit. So I think those are things that would definitely help with the transition. Just gaining that exposure early on would be nice. And also I think like normalizing that it's that transition is also very difficult for a lot of people, most people I would say, because it's really hard when you go from a student to the nurse, and it's just stressful. Maybe, you know, you're questioning like if you can do this or not, or if you want to do it anymore. So it's just like a lot of different emotions that people are dealing with.
I see. That's really cool to learn about. Again, the CNE thing is really cool, and that's not something we learn about in nursing school. So it's good that these supports are in place to help you adjust to the workplace. Ivy, I have a question for you. So I heard that you recently got to go to the CNSA conference, and I was wondering if you'd like to share some of your key takeaways from that conference.
Yeah, for sure. I think that would be a really good opportunity for any nursing student to go to, just because it's a really like extensive educational opportunity to just learn outside of nursing school as well as like clinicals. So in the conference, there's a lot of like research panels and different graduate students to share their experience about their journey, and a lot of about public health as well. And I would say my biggest takeaway, back to the question, would be first the leadership skills. So before, my stereotypical definition for leadership would be that I have to become the, the top of the group in order to become a leader. I need to be the best and then to lead others. Whereas my mindset sort of changed and altered to that leadership is more about a choice, but not a position. So you can also be informal leader, in which you're not entitled into a certain role that you have liability and must dedicate yourself to, but rather a way of living or your personality, your lifestyle, in which you are helping others in your daily life and leading people to the right direction. Yeah, but as well, there's also formal leadership, which is like the traditional way of leaders, in which you are elected or voted into your position in an organization, and then according to the position responsibility, you do your role as like a job. That is also a pathway into leadership. Also, public speaking, I feel like it's really useful into my self development as well as like um, being a nurse in the future, because I felt like communication is key in all the different fields as well as in healthcare. So not only we need to type good notes for the next shift nurse, but also to communicate with patients and coworkers to perform like an interprofessional workspace. So, and public speaking is a really valuable experience because we don't get that a lot in daily life. So, I do value the chance at CNSA conference that provided me with some public speaking skills. Moving on, I would like to extend to like what kind of skills you guys think we should have or should be developing while in nursing school about the professional role transition. For me, I would say it would be the meditation classes. So back in the first semester of nursing school, we have nursing 120, in which we learn about meditation and how to balance between the work and life balance, and how to avoid burnout, and all the like life hacks, as well as like as I mentioned, leadership skills and communication. These are all transferable skills in which can be applicable in any like nurses roles. So I want to hear from you, Farah. What do you think?
Um, Well, see that like definitely developing communication skills early on is very beneficial. I also think having a strong background in the hard sciences, so having more experience with anatomy and pharmacology and stuff like that. Anatomy specifically, I think, because that's like the foundation, and like having a strong anatomy foundation will is really important to me. Yeah, so maybe more anatomy classes would help prepare me and even just give me more confidence so that I know that like I know enough to be doing this. Yeah. What do you think, Sarah?
I think probably the biggest skill for professional world transition is building resiliency, because it can be very difficult, like I said, to transition from the student to the nurse. And it honestly can be really like mentally exhausting, emotionally exhausting, physically, of course, because you're on your feet for like 8, sometimes 12 hours for a shift. So I think just having that ability to be like, okay, so this is where I am currently. I'm still new. I'm here to learn, right? And I'm not supposed to know everything, and no one expects you to know everything. But what's important is that you don't like take that on out on yourself, and you try your best. You try to learn as much as you can, and then you always ask questions. And like being resilient as well is really important. Sometimes you have bad shifts, but then the next day you come back and you have a really good shift, and then you're able to like help somebody, or help, just really be there for your patient. So that's the thing. Nursing changes every single day. So and it's really, you have to be a lifelong learner.
Yeah. Yeah, that's definitely an important key takeaway. Ivy, do you have any thoughts before we end off today's episode?
Yeah, I really enjoyed our conversation. And just a final note, thank you for like nursing the future. This is an organization advocating to help nursing students in transition into the workforce. They do a lot of stuff, and if you check their website, there's a lot of resources for nursing students to use, such as like book clubs and a lot of notes and advice, as well as like speakers talking about the transition into the workforce. Overall, yeah, I enjoyed our conversation very much. Thank you all for the time today.
Yeah. And
Yeah.
stay tuned for our next episode. And don't forget to follow the Student Nurse Lounge. And yeah. Oh, Sarah, do you have any notes or anything to say before we end?
I just wanted to say thank you for having me. This is a great discussion, and I think it's really important to, um, have that exposure early on in your program, and like have tips and tricks and things like that to help nursing students.
Yeah. Thank you so much for being a great mentor to us all. And yeah, it was a great conversation. Stay tuned for next episodes and don't forget to follow our podcast. Bye.
Bye.